All right. So I'm Dr. Teresa Bousquet. I'm going to be presenting all things bunny, part 2. And yeah, I'm just going to quickly get my timer started so I can keep track of my time here. And then we'll go from there. Okay. So who am I? So I'm Dr. Teresa Bousquet. I graduated from the Western College of Veterinary Medicine in 2007. I now work at Harvest Point Animal Hospital, which is in South Edmonton. We're about 75% exotic. So I was sharing with Jade before here that I'm going for my board certification in exotic companion mammals, and one of my colleagues is going for his board certification in avian. So we see quite a lot of this kind of stuff. So I am a past president as well as a member of the Association of Exotic Mammal Veterinarians. I was actually the first Canadian president of the Association of Exotic Mammal Veterinarians. I also am a member of the Association of Reptile and Amphibian Veterinarians and a member of the American Association of Fish Veterinarians. I'm also a Hufflepuff. All right, so I was asked to discuss these 3 topics today. So dental disease, head tilt and vestibular disease, and then rabbit gastrointestinal syndrome. So that's what I'm going to talk about. So we were chatting about what's the best way to handle questions. So I think what we're going to do in this case, because I know that my lecture is pretty much about an hour long, and I know some of you are going to have to run away, I'm going to do the whole lecture first, and then we'll address questions at the end. So yeah, so feel free to drop questions into the chat, and then Jade will help me out with those afterwards. Notice, so the 3 topics that I was asked to speak about are, each of them individually could probably be at least an hour, if not multi-hour lectures in and of themselves, right? So I am very much skimming the surface a lot of these, and a lot of them could have a lot more information presented. So obviously you're not, I can't make you an expert in rabbit dentistry in 20 minutes. So I've had this little symbol here to basically be, there is a lot more to this than I'm able to present, okay? So for example, for rabbit dentistry, these are 3 individual textbooks that all talk about exclusively dentistry in rabbits, right? So these are entire textbooks. I have now read Dentistry in Rabbits and Rodents by Estelle Boehmer in cover to cover. There is a lot of information in there, holy cats, and there's no way I can cover that all, right? So be aware that there's a lot more information than I can present to you in this time. So diving right in. So dentistry. So rabbit dentistry, rabbits are quite unique in comparison to a lot of the species that obviously you guys are going to be used to. These are some of the definitions. Probably a lot of them don't really matter to you, but it just sort of gives you a bunch of information. So some of the highlight ones I'm going to draw your attention to. So there's hypsilodont, which means that they have a very long tooth body and a long clinical crown. There's aradicular elodont. So aradicular means they do not form a root, right? So like cats and dogs, they're what calls closed rooted teeth, right? So the teeth, when they develop, they form a root. Rabbits, they don't. So they are called aradicular. They have an apex that's open and continuously growing, and there's all sorts of fancy dancy cells doing all sorts of fancy dancy things down here, and their teeth are continuously growing. All of their teeth are continuously growing through life. Lophodont, basically it's just an interesting thing that their way their teeth enamel folds fold. I believe they're specifically bilophodont, which means they have 2 sets of these lophs. It's not that important for you guys, other than this can lead to tooth splitting, because if there's disease in the apex of the root, they actually have, their teeth are almost kind of split sort of anyways. And so if there's disease, that can actually lead to actual true splitting of the roots or of the teeth, and that can lead to problems. They're diphodont, meaning that they have deciduous and permanent teeth. This is really just mostly for interest's sake, because you actually don't normally see the deciduous teeth. The deciduous teeth are actually shed mostly before birth. And they do occasionally have deciduous teeth that persist into the first couple of days of life, but the chances that you're going to actually see those is pretty low. This part is the important part though. So dental formula for rabbits. So on the upper jaw, they have 2 sets of incisors. So this is actually what makes a rabbit a rabbit. and a lagomorph and not a rodent, is this feature right here. So rabbits have two sets of incisors in the upper jaw. So they have the big tooth that's in front, that is the one that you can see, right? And right behind it, there's what's called a peg tooth, right? We don't actually know what the function of the peg tooth is. There's sort of a theory that it plays a role in sort of sharpening this lower incisor as it comes up. But actually, if they lose their peg teeth, they seem to do okay regardless. So we're not really sure, but this is a defining feature of Lagomorpha, is that they have upper incisor, two sets of upper incisors. And sorry, I just pause for 2 seconds. I'm moving my cursor around. Can you guys see my cursor?
Yeah, we can see your cursor.
Perfect. Okay, thank you. Just wanted to make sure I'm not just like, you're like, what are you doing? Okay. Also kind of interesting. So as I said, two sets of upper incisors and one set of lower incisors. They have, and the rest of these are called cheek teeth. Functionally, they're all the same, so we just refer to them collectively as the cheek teeth. Technically, they actually have both premolars and molars, but functionally they're all pretty much the same. So I need to know this for my words, but you don't really. You'll notice that they have actually more upper teeth than they do lower teeth, but they're purposely designed so that they line up with each other perfectly, with like lengthwise here, right? So the length of the 6 teeth equals the length of the 5 on the bottom. Also, so agnognathic, actually most species are agnognathic, meaning that their width and their length of their jaws are not the same. We're agnognathic, right? So our maxillas are actually wider than our mandibles, and rabbits, it's the same. So the mandible is narrower and shorter than the maxilla. So the lower jaw is narrower and shorter than the upper. Okay. Uh-oh. There we go. So what causes dental disease? So this is also, it's complicated. There are some things that kind of we know really predispose them, but there's also a lot of things that probably also contribute that we're not fully, may have not fully fleshed out. So the main problem we have is the way we feed rabbits, right? So these two pictures on the top here are wild rabbits eating a natural wild rabbit diet, right? So you can see there's lots of nice grasses, but there's a mixture of different kind of herbage in here. And so they eat mostly grasses. In captivity, we unfortunately have a tendency to feed them stuff like this. This, of course, being probably the worst version, right? So because we tend to feed them pellets instead of grasses, right? Grasses, one of the interesting things about grasses is that grasses contain silicates, which are essentially sand, right? And so when you eat grasses, it actually is like a little bit like eating very fine sandpaper, and it slowly wears your teeth down. That's why rabbits and rodents and the other kinds of species, horses, cattle, that kind of stuff, evolved to have continuously growing teeth. Because if you didn't have continuously growing teeth, you would basically wear down your tooth a few millimeters until eventually after about 2 years, you have no teeth and you die. Right? So this is the rabbit's teeth are marvelously adapted to handle eating this kind of food. When we feed them this kind of stuff instead, what happens is that this does not have anywhere near the abrasiveness that we have up here with the grasses. And also, unfortunately, they tend to pick and choose. So they'll tend to choose these nice little soft sugary stuff, right? Or worse, they'll choose these seeds, which at no point are rabbits designed to eat seeds. That's not natural part of their natural diet. And they'll tend to leave the healthier stuff, which is these nice pellets here that probably have all the minerals and vitamins in them, right? And so they'll selectively feed from this instead of eating stuff that's nice and abrasive. There was actually a study that was done in the UK where they looked at different groups of rabbits that were fed different diets. And they looked at their outcomes, and they found, so they had and for this case, they call this muesli. We call this gourmet pellets, but they call this muesli. They had rabbits that were fed muesli only. They had rabbits that were fed muesli and hay, and then they had rabbits that were fed hay only. And they followed them out to see how did they do, right? It was awful, really bad. right? Basically, if you're fed a muesli-based diet as a rabbit, you have a significantly shorter lifespan, you're very prone to obesity, you have significantly worse dental disease, you have all these different health outcomes. To the point that when the same group decided we're going to go and do the same study in guinea pigs, they actually couldn't get the research approval because the outcomes were so bad for the rabbits that were fed the muesli-based diet. They said, we can't let you do that to guinea pigs because we assume it's going to have the same thing is going to happen. So feeding this kind of a diet is really, really bad. And really can lead to a lot of problems as far as dental disease. The other reason that, and that's number one, as far as the number one reason we see rabbits with dental disease is insufficient abrasion. Their diets are too low in fiber. We're feeding them this kind of diet instead of feeding, basically, this is the captive equivalent, which is hay, which is basically dried grass, right? So that's number one. Number two is reduced chewing time. This takes a little bit more thinking, but basically, this is obviously a lot less nutritionally dense than this, right? So in order to get enough calories to survive eating this, you have to eat quite a lot, right? So wild rabbits, they'll feed up to 20 times a day and they feed about 5 minutes each time, right? And so they'll hop around a little bit, eat, do their thing, hop around a little bit, eat, that kind of stuff. Whereas rabbits in captivity, we give them this, they eat all of this in probably 5 minutes, and then what? Right? They're not spending long periods of time chewing, right? So that is the second most common reason why rabbits have problems. And both of these are directly related to diet, right? So feeding an inappropriate diet like this instead of this is the number one reason why we have so much dental disease in rabbits. Now, there are additional factors, right? So one of these is inappropriate axial load. So basically, rabbits, when they chew, they have a very specific motion that kind of is this weird, and they've done all sorts of studies and show they have this very specific motion of their jaw. When they're eating grasses and hays, most of the pressure is actually side to side, right? When they're eating pellets, there's much more crushing pressure, downward pressure against the tooth. Okay, what that does is it causes the apices of the teeth, these little parts of the tooth, to actually push backwards through the jaw, right? What that does is that, and it can also lead to increased curvature of those teeth as well, because the apexes, they get pushed sideways as well. So they get pushed downwards through the bone and sideways through the bone, just from the pressure of chewing on that crushing motion, right? So you can imagine, I mean, if a small amount of your diet is pellets, but if a large percentage of your diet is pellets, then yeah, you're going to have inappropriate axial load on your teeth, and that's going to cause displacement of the apices, and that causes your teeth to grow abnormally, and that causes you to have dental disease. Energy-rich foods, so feeding foods that are high in carbohydrates also increase the rate at which the teeth grow. There's also vitamin and mineral deficiencies that can lead to this, various stuff like that. Genetics, so interestingly enough, male lop rabbits are overrepresented with dental disease, and then brachycephalic breeds. So this picture down here is just to get you to appreciate. So the picture in the back is a wild rabbit, like wild type rabbit, so like these guys here, right? And the picture in the front is what we've bred rabbits to be like. So this is a Netherland dwarf, and you can appreciate how brachycephalic they are, right? And because of this, they have the same exact number of teeth jammed into a much smaller space. So you can imagine, because of this, the margin for error is a lot narrower, right? So it's a lot easier for teeth to go wrong in this little head versus this one, right? So that's one of the major reasons why we see so much dental disease, is because unfortunately a lot of the pet rabbits we keep in captivity are actually really, really brachycephalic, right? Physiology, this part, you probably don't see this as often, but pregnant rabbits, so that, they're the changes that are associated with pregnancy, so as far as like calcium balance and all that kind of stuff, that can predispose them. Interestingly enough, cortisol, so high circulating levels of cortisol can alter your dental formation, and then chronic disease, which probably goes along with the high circulating cortisol. Lack of UVB exposure, that's an interesting one, right? Because we don't really have a solution for that one yet. But we have evidence from the UK that basically rabbits that are exposed to natural sunlight have more circulating vitamin D than those who don't. So the significance of this is kind of interesting when you think of rabbit physiology. So rabbits are a little bit weird in many, many ways, but one of the ways that rabbits are weird is that the amount of calcium that they absorb from their diet is directly related to how much calcium is in the diet, right? So it's not set by like us, we have X number amount of vitamin D, sun hits our skin, vitamin D becomes active, vitamin D tells our gut absorb this much calcium, that kind of thing. Rabbits just absorb all of it. And they excrete the excess through their urine. So vitamin D levels are not actually important for maintaining their circulating vitamins or their circulating calcium levels. However, the circulating vitamin D levels are important for their ability to lay it down in bone. So if you don't have adequate UVB exposure, you have less calcium laid down in your bones. And you can imagine with your jaw, if your jaw is not as strong and you've got these inappropriate axial load pushing backwards down on the teeth, that can lead to you having more dental problems. The problem we have with this is where we live, right? We live in Canada. These guys originally came from the Iberian Peninsula, so like Spain and Portugal, right? So they're not designed to deal with our winters, right? So the tough part with this one is it's not really appropriate for us to be keeping rabbits outdoors all the time. The other challenge we have with it is, and you've probably experienced this too, is that rabbits that live outdoor, it's kind of out of sight, out of mind, right? So people don't look at them every day, or even if they look at them to feed them or whatever, they're not really looking at them. And so a lot of times disease goes unnoticed until it's pretty advanced, right? Most of the cases that I've ever dealt with of rabbits that had maggots were rabbits that were living outside that they got diarrhea at some point and nobody noticed, right? So it's sort of a question of, is that the rest of life for them? However, there is evidence that, if they don't have enough if they don't have enough UVB exposure, they can have problems. So we haven't quite come up with a solution with this. Probably part of the solution is that they should be allowed some outdoor time, right? When it's appropriate seasonally to do so. I haven't had anybody recommending UVB lights for rabbits yet, but that might be on the offing, who knows? But certainly lack of UVB exposure can be related. Trauma. So trauma, this is common, particularly with incisor problems. And this is usually rabbits that were carried and then went over to somebody's shoulder and fell and hit their face, right? That's probably one of the more common causes of incisor disease in rabbits is actually trauma, right? So that can certainly be doing it. And then congenital. So there is a particular congenital condition that's called maxillary brachionathism. It's actually one of the more common reasons why rabbits get incisor disease. And it's basically that the maxilla is shorter than the mandible. And so the incisors sort of end up with the upper incisors falling way behind the lowers, and they just don't talk to each other, right? So congenital disease can be related to this too. So as I said, it's complicated. There's lots of different factors. The most important ones to remember though is this part, right? Because this is actually the most common out of all this stuff is insufficient abrasion, so not being fed a properly high fiber diet, and then reduced chewing time because they're being fed a concentrated diet instead of hay, okay? How do you diagnose this? So just like anything in any other species, right? History is part of this, right? So history that you might hear with things like drooling, things like not eating as well as normal, or even not at all, right? Changes in food preferences. So you can, if you see a picture, this is an endoscopic picture of a rabbit's mouth. You could imagine that if I have buccal spurs going off of my cheek tooth or lingual spurs going off this way, the long side to side motion of chewing could be really painful for me, right? So I may not want to eat hay as well as normal, right? But I might still be okay eating my veggies or my pellets, right? Because that doesn't require quite the same motion, right? So changes in food preferences, weight loss, changes in fecal quality, so and size, various different things like that, right? Those could all be signs. Those are really very obvious dental signs, but less obvious ones can be things like nasal or ocular discharge, right? So this, I've included this picture again to give you to show you this point. Ocular discharge in rabbits can be related to dental disease in two main ways. One is that is impaction of the nasolacrimal duct. So the nasolacrimal duct runs from the corner of the eye and it runs over top of the apices of these two premolars right here. Okay, so if there's disease in these two premolars and we have retrograde displacement of the apices of these two premolars, what's going to happen is that they press up against that nasolacrimal duct, and that can lead to tearing, right? So they can't, the tears can't go down the nasolacrimal duct because they're obstructed by this tooth, so they come back out. Right. So that's one way. The other way is a little bit more insidious, but basically, if you appreciate these apices here are sitting basically in the orbit, right? And if they overgrow, they actually grow into the orbit. And this can actually push back against the eye, right? It can also lead to things like retrobulbar abscessation and stuff like that, right? So ocular discharge, you have to have your little antennae up and say, hey, sometimes ocular discharge is related to dental disease. I really need to look this rabbit and see if there's evidence of dental disease, okay? Nasal discharge, they can have nasal discharge because of, a little bit more complicated, but basically because of disease extending from these teeth inwards towards the nasal cavity. Dyspnea, they can get abscesses that are secondary to dental disease that are inside the nasal cavity. They're obligate nasal breathers, so then that leads to them not being able to breathe. And then facial swelling, so if there's an abscess or something like that. Those can all be things that you can hear about in the history that can be like, oh, this could be dental disease, right? When you're examining the rabbit, obviously palpation of the skull. It sounds a little bit silly, but it actually is really useful. And the big thing is to do symmetrical palpation. So try to palpate both sides of the skull at the same time, because sometimes you'll feel asymmetry, right? And as soon as you feel asymmetry, something's up, right? Because they should always be symmetrical, right? So for the uppers, you want to be feeling right along the bottom of the zygomatic arch. You can actually feel the apices of these teeth here pushing up basically underneath the zygomatic arch. And then you want to feel along the bottom of the mandible, especially actually along the inside of the mandible, because when these teeth curve, they tend to curve inwards to the inside of the mandible versus these teeth that tend to curve outwards. So you want to feel along the bottom of the mandible and then along the inside of the mandible to feel, are there lumps on one side or the other, bony bumps that are not on the other side, right? Because that can be a really good indication that, gee, something's up. You can also look directly at these incisors here. Primary incisor disease is exceptionally rare in rabbits, but the incisor, so most of the time if you're seeing incisor disease, it is a sign that something else is going on with this rabbit. But looking at the incisors can still be very useful, because if you look at this kid, this is a normal rabbit, right? So features that you're looking for when you're looking at these incisors is, number one, they should be flat across like this, right? They should be white, right? The lowers should be tucked in behind the uppers, which is going on here. And if you were to turn this rabbit to the side, you would see the little peg teeth that are sitting between these upper and outer incisors and the lower, behind the lower incisors on the upper arcade. They should be, when you feel it, run your finger down them. Sometimes if there's disease, you can actually feel little bumps, like kind of like washboard, right? So this is what you're looking for in a normal tooth. Now, if you were to see teeth that are worn on an angle like this, right, it's probably not the incisors that are problem, but it's telling you, gee, there's something wrong here, right? Other things on dental examination, obviously looking inside the mouth, right? There's various preferences for how to do this. I usually use an otoscope with a long cone like this. This is in part just because the clinic I first graduated and first went to, that's what they had. So that's what I learned on. I will say that part of the reason I like this too is that it's got magnification, right? So it makes it look bigger, right? So you can see things. So I tend to do this. We have a set of otoscopes, cones that are designated for rabbit mouths, so that you're not putting, because they will chew almost continuously while you're doing this. So if you're using your nice dog otoscope cones to look down inside a rabbit's mouth, they're going to get ratched and you know, they would be uncomfortable to then take back and put down a dog's ear. The other option, these are a little harder to get a hold of, but this is a vaginoscope, right? And so you can see these little, the bottom part here pinches together, which opens up these blades. And so it pushes, the nice thing about this as opposed to the otoscope is this actually can push the cheek out of the way. So you can see this lateral aspect of the teeth a bit better. So this is an alternative. If you decide you really want this, I can tell you where to get it from, but this is no longer easily commercially available, just simply because apparently nobody else wanted this, just the exotic people. So we weren't in enough markets, so they stopped making them. So I know somebody who does this and who actually makes these. So if you wanted them, I can do that, but they're not easily available. The rest of these instruments are mostly things that you would use for doing a sedated exam. Sedated examination is important because a certain percentage of dental lesions are not going to be visible in an awake exam, partially because the rabbit's moving, right? And partially just because you can't open their mouth well enough. So you can imagine that on an awake exam, you're not really going to see, especially because of the big lump of tongue that they've got, you're not going to see these back teeth. So there could be a spike back here on an awake exam that you're not going to see, right? Until you can get in there, open the mouth nicely, and actually like get a little a Q-tip or something, push that tongue out of the way so you can see, is there a spike way back here, right? So about 30% of dental lesions are not visible on an awake exam, right? So just because you don't see it on an awake exam doesn't mean it's not there. Now, if you open a mouth and you're like, gee, there's like so much drool in here, you can't see the spikes, but there's a lot of drool, that's something that should raise your antennae to say, hey, I should do this examination under sedation because there's probably something there I'm just not seeing. However, I would be remiss if I didn't tell you that a lot of dental disease is also not visible on an intraoral examination, right? So if you really want to do this properly, the best way to do it is x-rays. Well, technically the best way to do it is CT. I'm assuming most of you don't have a CT. I don't have a CT. So most of the time this is done by x-rays. There's a really wonderful paper I want to draw your attention to. If you search this name, you can pull it on the internet and you can get it for free. Right? This paper is groundbreaking and so useful because basically they took skulls and figured out what objective lines can I put on a skull to say, is this normal teeth or not? Right? So this is an example, lateral view of a rabbit skull. So if I draw a tip from the line from the tip of the nasal bone to the occipital protuberance, all of the cheek teeth, all of their apices should fall below this line. If they're above this line, that's abnormal. Okay. So they did a really wonderful paper that's so useful because otherwise it can be really difficult to interpret what you're looking at, right? Especially if you don't do this a lot. I will point out that in order to do this, you need a really truly lateral x-ray. So for example, if you look at this, you can see that it looks like I only have one bulla here. So that's because the bulla are perfectly positioned one on top of the other, right? If the bulla are making a figure of 8 or something like that, you can't do this because they're not properly positioned. So this does require sedation because you're not going to get this properly positioned with them awake, right? But it can be very useful to be able to look at the skull and say, oh, that's what's going on. Now, obviously this kid over here, this is a train wreck kind of situation. So you probably, even without ley lines, could say, gee, this is not right. But if I was to imagine drawing a line here, you can see, right, that these apices have been pushed retrograde up into the skull. You can see this upper incisor is not even talking to the lower incisor, and it's curling around inside the mouth and overgrowing. You can see that these roots are pointing all sorts of different directions. You can see compared to this one here, right? These are all pointing different directions. This tooth is curving more than is normal. This tooth is curving more than is normal. So this is kind of a train wreck. But for more subtle cases, this kind of interpretation is very useful. And then, of course, CT scanning, that is the gold standard for examining dental disease in a rabbit. Most of you are probably not going to have access to it, but it can be very illuminating. We've had cases where we took radiographs and then we then sent them for a CT, and holy cats, like you can see so much stuff on a CT that you obviously can't see on an X-ray. So it is very useful, not accessible to all people though. Treatment of dental disease, it's complicated, but I mean, in long and short, it's basically trimming the teeth back to as close to normal occlusion as you can, right? This is a palliative management. Nothing you're going to do to trim these rabbits' teeth is going to fix the fact that the roots are doing, not the roots, the apices are doing this, right? You cannot fix this, right? This disease is going to be here the rest of this rabbit's life, right? So it's very rare that we're ever going to resolve the rabbit's dental issues by doing molar burring, right? What we're doing is we're giving them comfort, we're buying them time, and we're keeping them happy as best we can, but we're not fixing the problem, right? Most of them are going to need regular molar trimming the rest of their lives, right? And I tell that point blank to people when I have a rabbit that has dental disease. I want them to understand this is the rest of the rabbit's life. This is not once and done. This is the rest of the rabbit's life. And some of them are going to need really advanced interventions, right? So they need extractions, they need abscess repairs, that kind of stuff, right? And then, of course, they're painful. Like if you look at this kid back here, it's hard to, I was trying to find good pictures. You look at this, there's a giant spike coming off of the lower arcade that's abrading the surface of the mouth, the roof of the mouth, right? This has got to be intensely painful, right? And I can trim this spike back, but this is going to keep regrowing over and over and over again, right? So, I mean, I'm not a shelter vet, full disclosure, right? So you got to ask yourselves, though, is this the right thing for a shelter to be doing, right? And that's probably going to vary according to shelter policy, shelter, you know, how much money you guys have and who you're potentially sending these kids home to. But like at the same time, like you got to decide, are we going to invest our resources in a rabbit that basically has a palliative condition, and that is going to be very difficult to find a proper home that's going to willing to take this on, right? You got to ask yourselves, is this the right thing to do? And I can't answer that question for you, but you know, that is something you'll have to think about. Okay, moving on. Head tilt. So just like in cats and dogs, head tilt is usually related to disease within the vestibular system. So as you probably know, the vestibular system is important for maintaining posture in relation to gravity. It's basically telling you which direction is up, right? And it's in control of the movements of the eyes relative to the position of the head. So your vestibular system is the part of your body that you can thank for the fact that you can turn your head without getting dizzy, right? So just like cats and dogs, disease can be either peripheral, so in the outer ear, or it can be central, like in the brain, right? In rabbits, obviously, there's just the same sort of differentials as there are in a lot of species. So it can be neoplasia, it can be abscesses, it can be trauma, it can be vascular disease, it can be toxical osmosis, it can be a lot of different things. However, most of them, it's two things, one of two things. So either encephalozooon caniculi or pasteurellosis, right? And I'll get into this a little bit more, but so E. caniculi, about 50 to 75% of the rabbits, depending on which serological study you look at, have E. caniculi, right? A lot of them will never, ever, ever have signs, right? They just have it in their system and it's just there, right? Pasteurella is actually part of the nasal, natural flora of the nasal cavity. It's there all the time. So when they have Pasteurella and it's causing disease, it's just there as an opportunistic pathogen. It's not that they picked up Pasteurella from somewhere magically and just, you know, started having problems. They all have Pasteurella. In the lab animal world, if you want a Pasteurella-free rabbit, you actually have to C-section them. And even C-sectioning won't prevent them from getting E. caniculi because they actually get E. caniculi in utero. So they're pretty much all have it, right? It's just a matter of whether it ever actually causes problems. E. caniculi, boy howdy, this could be every year at ExoticsCon, there is a round table about E. caniculi that's basically what have we learned about E. caniculi in the last year. Because E. caniculi is that much of a moving target right now, and it's that complicated. So right now, it used to be considered a parasite, like it used to be in that category. Now it's actually considered to be a microsporidian, which is specifically a type of fungus that is a spore-forming unicellular obligate intracellular parasite. And the whole class of microsporidians, that's what they do. So it's a microsporidian. So when they did PCR DNA sequencing on it, it's actually a fungus. It can affect a lot of species. That's one of the interesting things that I've learned, is that a lot of species actually can get E. caniculi. It's just that we famously associate it with rabbits. People can get E. caniculi, mostly immunocompromised people, but people can get E. caniculi. Sorry. As I said, infection usually is latent, right? So the fact that you have E. caniculi does not mean you're necessarily going to develop disease from E. caniculi. You may never develop disease from E. caniculi. When it does happen, it's a very inflammatory granulomatous disease. It can affect the brain, the kidney, and the eye. Definitive diagnosis is really hard in an ante-mortem situation, right? Currently, the way we do it is a panel that's IgG, IgM, and C-reactive protein. The reason why it's complicated is because, as I said repeatedly, almost all rabbits have this disease. So it's not good enough for me to test this rabbit and say, do you have E. caniculi in your system? Because almost all of them do, right? So I have to ask, do you have E. caniculi in your system, and is it causing you problems, right? And that's what this panel is essentially telling us is, yes, I have E. caniculi. Yes, it's causing me a problem, right now, right? And so that's where the panel is. It's sent to I believe it's the University of Florida. They're the ones who do all the have been doing all the research on this. So it's an expensive panel, but that's basically how we definitively, or that's how we diagnose it in an antemortem state. Obviously, postmortem you can do various biopsies and stuff like that, but antemortem it is this panel. How do we treat it? Honestly, most of the time it's fenbendazole. It's sort of funny that fenbendazole works because, as I said, this is not actually technically a parasite. This is actually a fungus. However, seems to work. The thing you need to know about fenbendazole that most of us probably don't run into, because when you use it in a cat or a dog, you're kind of using it like one-off or, a couple times kind of thing. You're not usually using it for 28 days straight, is that fenbendazole can cause bone marrow suppression. So when you have a patient on this therapy, you really should be monitoring their CBCs before starting treatment, during treatment, and after treatment to be watching for evidence of bone marrow suppression. Because it can cause irreversible bone marrow suppression. So you have to be aware of that. Bacterial Tysomenia, most often we call it Pasteurella, but actually other bacteria can do it. So Staphylococcus, Streptococcus, Bordetella. Interestingly enough, rabbits can carry Bordetella in their nasal cavities as well. Pseudomonas, E. coli, Proteus, all sorts of different stuff. Pasteurella multocida, as I said, is part of the natural flora of the rabbit's nasal cavity. It can go up the eustachian tube into the inner ear, and that's where it can start causing problems with otitis media, which can then spread to be otitis externa or interna. Clinical disease with this condition is usually related to stress. And so, as I said, it's an opportunistic pathogen. It's waiting for you to become immunosuppressed so that it can go do bad things, right? So weaning, transport, purchase, going to a shelter, things like that, right? Diagnosis of this, really definitive diagnosis is pretty hard because trying to culture the middle ear is probably not something that most of us do on a routine basis. So, I mean, you can see it sometimes on x-rays. You can see it better on CT. The fact that you don't see it on x-ray does not mean it's not there. It just means you're not seeing it. And I've seen many, many cases where we took an x-ray and thought, gee, those bulla look fine. And then we take a CT and boy, howdy, no, they're not, right? But definitive diagnosis of that is hard. I will point out that E. caniculi does not cause radiographic changes in the bulla. So if you're seeing radiographic changes, it's not E. caniculi, it's something else, right? What do we do? Because definitive diagnosis of these is hard, we usually do empirical therapy for both conditions. So we usually treat them both with antibiotics and with fenbendazole to cover both bases, okay? And then supportive care, right? So fluids, assist feeding, supporting the rabbit. You can imagine this poor kid, he actually probably is continuously rolling. So when we have rabbits that are in this stage of disease, what we essentially do for them is we wrap them up. We either wrap them up in a towel or we sort of roll towels to make a bumper on either side of them to sort of hold them so that they're not rolling. Okay. Interestingly enough, when I was studying for this seminar, I came up with a lot of things that were talking about using steroids for this. Apparently, the reason why is because E. caniculi, when it's causing disease, it's not really the E. caniculi itself, it's the body's response to the E. caniculi that's causing most of the issue, right? So there's a theory that if you treat them with a short dose or even a single dose of steroids, that may reduce a lot of the damage that is result of that, because you're suppressing the body's over response to the E. caniculi. I'll be frank with you, I've never done that. I have to think really hard about whether I do that. There is kind of dogma in exotics practice that's been proven to be maybe just dogma, that you never, ever give rabbits steroids. You don't, and it's sort of true in the sense that please don't just give rabbits steroids for no reason, without really having thought it through. The reason why the dogma exists is because you can cause immunosuppression that can lead to problems, right? However, we do know, for example, from thymoma, which is a cancer that happens in the rabbit's chest that otherwise there's no treatment for other than like radiation therapy, which nobody's going to do. We know that rabbits the new treatment now for thymoma is actually put them on steroids. And I've had patients that have been on steroids for over a year and did really good, right? So it's not the death sentence we thought it used to be, but we still have to give it really a lot of respect, that it can cause problems. And when there's owners involved, we always have to warn them, hey, we're going to do this. There's a risk with doing it. And then things to be understanding is that we're not curing these diseases, right? We're not really curing either of them. Pasteurella, no matter how much antibiotics they give that rabbit, there's going to still be Pasteurella in their system. Pasteurella actually can make biofilms. So it's really almost impossible to kill fully Pasteurella. And E. caniculi, they've done studies and they show that even if we do the whole 28-day treatment round, you don't actually clear the parasite or the fungus, right? So we're not curing them. We're just dealing with their symptoms, right? And reducing disease. Excuse me. In addition, when we're treating these kids, one of the other things I do is I typically lubricate the down eye. So again, with this kid, you can appreciate this down eye, if this rabbit's not being restrained by a human, is probably sitting on the substrate, right? And especially if this rabbit's rolling, they're braiding their eye on the substrate, right? So rabbits often will get an ulcer in the down eye. So in cases like this, I do usually have the owner go home with lube for the eye. I also usually am doing fluorescein staining to make sure there isn't already an ulcer on that eye, because they're very prone to getting ulcers on those eyes. Prognosis depends on severity of symptoms. In my reading, I came across that basically if they are not eating on their, like if they're not eating, prognosis is poor, regardless of the reason why, right? Normal activity, this was also interesting. Normal activity should be encouraged as soon as reasonably possible. So obviously not this kid, because this kid, if I let him go, he's just going to roll. But once he's past that stage, we actually want to encourage them to move, because it's basically by making them move, we're retraining the vestibular system, right? Because we're making them use it, right? If you don't use it, you lose it, right? So by making them move and encouraging movement, we're helping them retrain their vestibular system. And apparently their recovery will be faster if they're allowed to move, and will be fuller if they're allowed to move versus if they're immobilized for too long. Some rabbits will have a permanent head tilt and can still live fairly normal lives, right? These kids, you know, this kid here has a permanent head tilt. He doesn't have to run away from predators. He doesn't have to go foraging for food. He doesn't have to find the water source. He just needs to be able to find the bowl of greens and hang out with his buddy, right? So, you know, they can actually live pretty normal lives with a head tilt and do okay, right? So even if they do have a permanent head tilt, they can actually do relatively okay. All right, last bit. So first, before we get into rabbit gastrointestinal syndrome, I need you to understand a few things about rabbit anatomy. So they're a herbivore, unlike what Monty Python tells us. So they are a true herbivore. They're monogastric. So they're, you know, basically up to about here, they're like us. right? So they have a normal, they have a stomach, single chambered stomach. This is a very, very acidic stomach, but it is still a regular stomach. They have a small intestine, they have a pancreas, they have all of this stuff is pretty normal. Then this is where the magic happens, particularly here, okay? So here, what happens is there's an area of the gut that sorts small fermentable fibers from long non-fermentable fibers. Long fermentable fibers go back down through the GI tract and become this kind of poop, right? The regular kind of normal, we call this dry, depending on the book, these are the hard feces, okay? This is what happens with the non-digest fermentable fibers. The fermentable fibers go backwards into the cecum here, right? And the cecum is full of this wonderful population of various types of bacteria. There's also actually some fungi that live in here. There's some protozoans that live in here, all sorts of stuff that lives in here that ferments those small fermentable fibers. They produce lots and lots and lots of volatile fatty acids. Some of those volatile fatty acids are actually absorbed directly through the cecal wall and immediately become energy from the rabbit. A fair percentage of them, though, come back out. So they have a very special part of their digestion where the cecum contracts and this thick brown pasty stuff comes out. It goes down the colon, it's coated with mucus, and then it comes out and they re-ingest it. And that's what this is. This is a cecotroph, okay? They have a very distinct smell to them, and it's because they're full of volatile fatty acids. They also have amino acids, vitamins, minerals, and actually protein, most of which is bacterial protein. Rabbits get up to 30% of their daily calories from eating these, okay? And so rabbits, most of the time you won't see this because they know they can feel the special contraction when it's coming down the colon, and they just bend and grab this, okay? This is an important thing to be aware of, though, because this often gets mistaken for diarrhea in rabbits, because if the rabbit doesn't ingest it, this kind of gets mashed into the fur around the anus, and people look at the rabbit and see sort of foul-smelling, soft stool mashed around the anus, and they say, oh, this rabbit has diarrhea. And most of the time it's not. True diarrhea in rabbits is actually fairly rare. Maybe a bit more common in your situation just because of the particular patients you deal with. But in my world, true diarrhea in a rabbit is rare. So most of the time when I'm seeing diarrhea in a rabbit, what it actually is that they have not ingested their cecotrophs. Okay, there's a lot of reasons why you may not ingest your cecotrophs. Some of that can be related to diet. So if you're on a really high plane of nutrition, so you're on a high protein, high carbohydrate diet, they have various signals that tell them, no, you don't need to bother eating this. If they have pain somewhere, so if they have pain in their you can imagine if you have pain in your tooth, if you have pain in your bladder, if you have pain in your spine, you may not be able to bend that way to go and get your cecotrophs. If you're obese, you may not be able to bend that way to go get your cecotrophs. So if you're seeing diarrhea in a rabbit, you need to be aware that the most likely cause is this, right? And you need to be looking for, why didn't you eat your cecotrophs? And if it's becoming a routine thing, you need to really be looking for, what do you have a source of pain? Right? Because a lot of them, that is what it is that they either they've done something stupid in their youth and they have spondylosis in their spine, they have arthritis in their hips and their stifles, they have dental disease, so when they bend, their teeth poke into their tongue or something like that. So you have to, if you're seeing diarrhea, you need to be aware that it's most likely cecotrophs, and you'll smell it. It has a very specific smell, and you need to be looking for that. So rabbit gastrointestinal syndrome, this is what we call GI stasis nowadays. In lay terms, people call this hairballs. I really hate the term hairballs because it's not the hair that's the problem. It's the gastrointestinal motility, right? So specifically, this is a syndrome of reduced or absent gastrointestinal motility. And this results basically through things backing up. It backs up into the stomach and you get this impacted mass of food in the stomach, occasionally in the cecum, and that leads to all sorts of derangements. Rabbits who have this because of various effects, they're dehydrated. It can cause all sorts of different derangements. So they're acidotic, all this kind of stuff, right? So And it's not the fact that it's not the contents that's the problem. It's the fact that the gut isn't moving. That's the problem. This is almost always a secondary condition. So don't identify that a rabbit has GI stasis, pat yourself on the back and say, good, I've solved the problem. You need to go looking for why. Why did this rabbit develop gastrointestinal stasis? My joke for people is that rabbits are basically gastrointestinal tracts with ears. So everything that affects the rabbits can affect the GI tract. So it can be pain. So again, I have dental pain, I have abdominal pain, I have, musculoskeletal pain, I've got urine scalding that's causing me pain. I've had surgery. Pain can do it. Stress. So, gee, I saw a hawk outside the window and I'm terrified. Or I'm in a shelter situation and I'm hearing dogs barking all the time and I can smell the ferrets next door and Jesus is terrifying. To inappropriate diets, so especially low fiber diets. Primarily being on a pellet-based diet because the fibers within the hay and grasses stimulate GI motility. So pelleted diets don't stimulate motility in the same way. High sugar, high carbohydrate foods, seeds, nuts, all that kind of stuff. Infections, neurological disease, basically anything can cause GI stasis. So you need to go looking for, does he have some of those problems? Sometimes you don't find it. And it just may be that, you can't really easily identify, gee, there was a hawk outside that it scared me, right? But especially if it's happening repeatedly, you need to go looking for the why. Rabbit GI stasis can lead to hepatic lipidosis, particularly in fat rabbits. So like cats, right? So cats develop hepatic lipidosis quite rapidly. When they're anorexic, rabbits do exactly the same thing. So they can go into liver failure very quickly. So you need to be really, really on the ball and make sure you're catching these patients as soon as possible, because if you wait too long, they can end up going into hepatic lipidosis and they can die. So you need to be aware of that. So diagnosis. So most of the time it's going to be like, gee, he's not eating as much, he's not pooping as much, or he's got poops that look like this. So instead of the nice big fat, beautiful poops that are here, you have these little shrivelly, sad little raisin poops that are stuck together. Sometimes they'll be stuck together with hair, things like that. That's an indication of GI stasis. Okay. So if you're seeing poops like this, that's not good. You need to do something about it. The rabbits, most of the time for just regular run-of-the-mill GI stasis, are going to still be fairly bright and alert. Assume that they're all dehydrated just because of the osmotic changes that happen through their gut. Basically assume that they are dehydrated. Basically, when you palpate the stomach, the way I describe it is, it's doughy. So it's like bread dough, right? So you grab the stomach in your hand and you squish it and you can like make your thumbprint in there. You let go, you come back and your thumbprint is still in it, right? So it's doughy, right? And it's firm, instead of kind of nice squishy contents like is what's normal, right? A lot of people, borborygmi are kind of controversial in my world. There's some people that really believe in borborygmi and some people that don't bother. I'm kind of in the don't bother camp. Part of the reason is, especially now that I know more about rabbit physiology and what I'm expecting, if they're not actively eating, their gut isn't moving very much. So I don't really expect a rabbit that's anorexic to have much for borborygmi. There is some argument that maybe it gives you more information as far as when it starts to improve. But for the most part, you can also feel that physically, right? So I don't really bother that much with borborygmi. I don't find them to be that useful. I find that all the other stuff to be much, much more useful. But I have colleagues that swear by doing borborygmi. So it depends on you. The other part that you really need to be aware of is that there is a really bad thing that can happen that people often mistake for GI stasis that isn't GI stasis, and it's much, much more serious, and that's GI obstruction. GI obstruction is basically where most of the time it is a trichobezoar, so it's a like hunk of fur, a mat of fur that gets stuck, and most commonly it's going to get stuck in the duodenum. And it causes backup of fluid and gases and everything in the stomach. And this is life-threatening. Rabbits are physically incapable of vomiting. and they're also physically incapable of burping. So if things can't go forward, they run into problems very, very rapidly. So these rabbits, you need to have the ability to distinguish these rabbits fast, because this can be rapidly fatal. So things that are going to differentiate. So these rabbits are usually lethargic. They look sick, right? They're hypothermic. So it's really important. This is an important point here. Be aware that rabbit temperature is higher than a cat or a dog. So their normal is 38, depending on who you ask, maybe 38.5 up to 40. So if, again, cat dog vets will sometimes they'll take a temperature and be like, oh, it's 37.3, it's fine. Because if it was a cat or a dog, that would be fine. In a rabbit, that's life-threatening, right? That is hypothermia, and that's a sign of problems. But you also have to make sure that whoever took this temperature did it correctly. There was a study that came out in guinea pigs that was kind of funny. They were comparing different types of thermometers and what measures temperature most accurately. And they stumbled across the fact that if you insert a rectal thermometer only 1 centimeter into the colon instead of 2 centimeters into the colon, you have a dramatically different temperature. So you need to be aware that if you have somebody who's kind of a little bit wussy about it and they're only sticking it just barely in, they're not getting an accurate rectal temperature. So I'll be honest with you, whenever I get one of these rabbits that comes in and it comes back hypothermic, I check it again just to be safe. But if it's real, then we need to treat that very seriously because it can be life-threatening. So be aware, number one, what the normal temperature of rabbit is, right? And number two, that you're actually taking it properly. So a lot of clinics, exotics clinics nowadays actually have a little marking on their thermometers that says this is where 2 centimeters are, so that people aren't just barely sticking it in, okay? Marked elevation in glucose. Now marked, I'm meaning marked, right? So when I take blood glucose on a rabbit, very often I'm gonna get like 12, right? Which is not normal, but it's not stupidly high. And that's basically, I'm a stressed out rabbit, which pretty much I assume all rabbits who are in clinic who are having their blood taken are probably stressed out rabbits. So that I'm not concerned about. But when they get up to like 20, that's bad. That can be a sign of very serious disease. And then the most important thing is when you're palpating them, the stomach feels tympanic. One of the best descriptions I've ever heard of this is that it feels like a blocked cat's bladder. Okay, so when you palpate, if you get in there, instead of the doughy stomach, you're feeling like something that's rigid and it doesn't compress, that's bad. Okay, even some of them in the early stages may be partially rigid and they're like gassy, but you can't fully compress them. That's not normal. That can be an obstruction. The best way to differentiate these for the most part is going to be to take x-rays. Okay, and again, this is a really important paper that you can pull that gives you the information as far as where do they get this information from. So on the left here, this is a rabbit that has GI stasis, but it's not obstructed. Okay, so I've got nice mixed density contents here. The stomach is a bit big, but it's mixed density. There's gas scattered throughout the GI tract. This is a pretty standard, this is a GI stasis rabbit. This is an obstructed rabbit, okay? And the things that tell me this is obstructed. So number one, instead of having this nice mixed density stomach here, I have a fluid density stomach. I can't see food content or food contents, right? We also have what we call the fried egg appearance, right? So this is a gas cap here, right? You can appreciate that this one, the gas is all spread out. Here, it's all in one gas cap. This is the fried egg appearance, right? So this is an obstructed stomach. This is also extending to L2, or actually probably a little bit past L2. There's increased sternal contact here. So this is an obstructed rabbit. This is an emergency. This needs immediate care, okay? What do you do? So if it's a GI stasis rabbit, then it's usually pretty routine, right? So we give them pain control. The current dose at the moment for rabbits that is scientifically validated is 1 mg per kg SID. I fully acknowledge that that may change over time, but that's currently the research dose. And I know that sounds scary for cat dog people who are like used to 0.1 milligrams per kilogram, but I'll tell you the study that they did is they gave this dose every single day for 30 days. And then they sacrificed those rabbits and looked at the kidneys, and the kidneys were like, hi, I'm great. So feel very confident, give them 1 mg per kg. right? They need that, okay? A lot of times we also do give them injectable opioids. There's a funny detail with this. I mostly use hydro in this case, unless I've got a catheter in which case I use methadone. The interesting detail about this is that there has been some studies looking at methadone and routes of administration. And interestingly enough, methadone doesn't seem to work in rabbits unless it's given IV. So if you don't have a catheter in them, I would err on the side of hydro instead of methadone. Now, people freak out about this sometimes because we know opioids can also slow GI motility, but we really need the opioids in a lot of these cases because pain suppresses GI motility. So we need to make sure we're addressing pain appropriately, even if there is that trade-off that it can suppress GI motility. We give them fluids. Be aware that the rabbit's dose is higher than a cat or a dog. So rabbit's maintenance dose of fluids is 100 to 150 mils per kilo per day, which is many times, or well, not many times, but it's significantly higher than a cat or a dog dose. So make sure that you're dosing them knowing that they do need more fluids than a cat or a dog. So typically when I'm doing sub-Q fluids in a rabbit, I do 3% body weight, so 33 mils per kilo per dose. And I'm doing that about 3 times a day. Make sure it's warmed. Ideally should be LRS because all of these kids are, this is again getting into detail, but pretty much all of these kids are acidotic. And rabbits, for various reasons, really suck at correcting acidosis. So if you go ahead and give them saline, then you're going to potentially make them more acidotic, and they're not really great at fixing that. If you have no other choice, yeah, give them saline. It's better than nothing. But if you have choices, give them LRS because that's better. And then syringe feeding them. I have no particular preference between oxbow critical care or herbivore care. Herbivore care, I may be a little bit more inclined to use in cases where it's a really, really sick rabbit because herbivore care is more elemental, so it's broken down a little bit more. So if it's really, really sick and I'm worried that they're not going to be able to absorb the nutrients from it, I'm a little bit more likely to use the herbivore care. But really, either of them is fine. Both of them are currently on back order. But yes, you're going to syringe feed these, and this is a non-surgical condition. Okay. On the flip side, GI obstruction. Okay. So GI obstruction, these kids are in a lot of pain, like really, really. So these kids, we put them on a lidocaine CRI, and this is the dose that you do. And we absolutely give these kids injectable opioids because these guys are in immense pain. They get IV fluids, right? Sub-Q is not going to cut it. These kids are essentially, a lot of them are actually in shock because you can imagine, so this stomach here is pressing up against the vena cava and reducing venous return to the heart. So these kids actually are often in shock. Okay, so if you just put a blob of sub-Q fluids there, they ain't gonna do nothing about it because their peripheral vasculature is contracted and not doing its work. So you need to give these kids IV fluids. Okay, a lot of a certain percentage of these kids, we will also go in with a stomach tube, and we will try to drain some of this gas and fluid. Okay, that gives them some immediate relief, right? And it helps to get them out of shock faster. The nice thing about rabbits is that they're really hard to intubate. So unless you're really extremely weirdly lucky, you're almost certainly not going to hit the trachea when you're passing a stomach tube into a rabbit. So basically, yeah, you mark your tube for the end of the rib cage, and then you go down and you suck stuff out of it, right? Usually you're going to add more holes to the tube. And obviously this is something you're going to do under sedation. You're not going to do this with an awake rabbit. But you can actually get them out of shock faster by draining some of this fluid out of them. You will absolutely not be force feeding these kids. And this is part of what you need to be able to distinguish, okay? You are not going to force feed these kids because they are obstructed. And by force feeding them, all you're doing is adding to the problem, right? So we are not assist feeding these kids. My rule of thumb with these kids usually is I don't usually assist feed them until they are voluntarily eating on their own. And or are pooping on their own. And then at that point, I can be fairly confident the obstruction has resolved. Sometimes surgical intervention is needed. About 75% of these cases will get better with the medical management, but a certain percentage of them won't. And if that is the ones that you have come across, then yeah, you cut them. I will share with you that it's like, I'm terrified of that idea. And I know there was sort of the dogma of if you cut a rabbit and you go into their intestine, they're going to die. That apparently is not the case. A certain percentage, Nicola Di Girolamo is in the midst of publishing that his rate of success with these kids is actually 75%. That 75% of them survive that surgery. And some of them, there is no other choice other than surgical intervention. I'll leave it to you whether you're brave enough to be the one that does this. But if you have to do it, it isn't necessarily a death sentence. It sometimes is the right thing to do. All right, did I make it on time? Well, close. All right, so that's it. So now I guess I can, I'll stop my screen share and we can chat.
Thank you. That was really great. We did have one question. Someone is wondering if you can use a glucometer for cats and dogs on rabbits, and if so, which setting you would.
Yeah, I have to look and see because I know that too. We used to use in ferrets. So in ferrets, the oh, what is it called? One of the glucometers was actually validated in ferrets, and I don't think the glucometers have been validated in rabbits. So if you choose to use a glucometer in a rabbit, it's probably not the end of the universe, but just keep in mind that it's maybe not necessary. It's generally not as accurate as a tabletop actual machine. So so be aware of that. Oh, it bugs me though, they can't remember the name of it. But anyways, there was one of the glucometers was actually validated in ferrets, but now it's no longer available, and they're now on to the third version of that, and that one has turned alpha track. Thank you. And so the alpha track 2 was validated in ferrets on the dog setting, believe it or not. But they've been since looking at the alpha track 3 and found that it is not. So unfortunately, yeah, so so I see somebody said I've reused the cat setting. So the dog setting is validated in ferrets on the alpha track 2, and has been found to be more consistent, although they did do a study to show that it actually fairly consistently underestimates the blood glucose level. So it's better, but it's still not the be all and end all. The best thing is to use an actual tabletop machine.
That's great. Someone else is also wondering if there's any benefit to using antihistamines for dizziness or NSAIDs for supportive care in a rabbit with a head tilt. They're also wondering on the topic of NSAIDs. They've always used Medicam in rabbits, but they're wondering if any others are also safe.
So I primarily have experience with Medicam. I do think some of the others have been looked at. I share with people, I mean, if you think about it, rabbits are a lab species. So a lot of medications have been used in rabbits. They've just not really been validated in the outside world, but they've actually been used in rabbits. So they absolutely are. I think carprofen has been shown to be good. Interestingly enough, there's a textbook that I don't have it in the room here. There's a textbook called The Textbook of Rabbit Medicine by Molly Vargas Smith. And she actually really likes acetaminophen, which is interesting because, in the veterinary world, we're often really afraid of acetaminophen. But acetaminophen is actually a really great drug as long as you use it at the right doses. The nice thing about acetaminophen in a GI stasis case, for example, is that we do know rabbits are very prone to ulcers. So you can safely use acetaminophen without having to worry about whether you're going to make ulcers worse. So yeah, there definitely are other drugs. I'm just most familiar with Medicam, and certainly Medicam does have a potential role. Obviously, if you give them a dose of corticosteroids, and if you're that person, don't give them Medicam. But otherwise, yes, absolutely, you can give them some Medicam if you're a head tilt rabbit. I also don't often use antihistamines, but I do know a colleague of mine, we have a rabbit that we're dealing with right now that has severe otitis interna that actually just had a peekaboo done. And he's on an antihistamine for dizziness because he just had a peekaboo done. So we just certainly use those medications. Yeah.
That's great. Another question is that they said, thank you, that's really interesting for answering. They're also wondering what you think about using slow release buprenorphine for pain management.
Yeah, I think they do that more in the States. I can't really comment on it a lot just because we don't really have the product here that's the actual commercial product. I think my understanding is the problem with the compounding product is that it's not very controlled as to how quickly it releases. So it you can have a rabbit that all of a sudden gets a massive amount of buprenorphine all at once. I can't say I have a lot of experience. I do know people in the States use it a fair bit, but I have not got a lot of experience with it.
Great. In the chat, we have 2 questions. So Gabrielle was wondering, in a shelter, if they have a rabbit displaying nasal or ocular discharge, should they be considering them as contagious, so therefore not letting them have time outside their cage with?
That's a tricky one because, yeah, but most rabbits will probably have the diseases that that rabbit has already, right? So yes, there's probably a small percentage of rabbits out there that don't have that kind of stuff in their nasal cavity already. And so yes, theoretically, they could be infectious. But a lot of them, all as I said, almost all of them have Pasteurella in their nasal cavity. But that is an interesting point as far as guinea pigs. So guinea pigs are very profoundly susceptible to Bordetella. And as I said, while we often blame Pasteurella multocida for this kind of syndrome, Bordetella bronchoseptica can be the one that's doing it, right? And rabbits can carry Bordetella bronchoseptica in their nasal cavity as part of their nasal flora. When it gets into a guinea pig, it can cause profound disease and can be fatal. So you'd want to be very careful that a rabbit that's looking like that is not exposed to guinea pigs because they could be potentially very dangerous to guinea pigs.
There's another question in the chat about using 3 different kinds of medication for GI stasis, so cisapride, Cerenia, and trimebutine.
So the last one, I don't know what that is. So I'm sorry. So what I tell people about metoclopramide and cisapride is that when they've studied these in they've done a number of studies to try to see, does this actually do anything at all? And so far, it doesn't. So I tend not to use those promotility agents. I tell people it's like, plus it sort of bothers me because like the problem is, most of the time you need to fix the underlying cause and then the gut will move, right? So I don't typically use either cisapride or metoclopramide. As I said, the evidence based on a number of studies has been that basically it does nothing. And of course, no drug on earth is without side effects. So you're giving something that has been demonstrated to do nothing in a case that then the risk of side effects of the drug itself is worse than or is not outweighed by the benefit of the drug. As far as Cerenia, I think the evidence is still out as far as whether Cerenia is beneficial. I think Cerenia certainly has a lot of interesting potential, just simply because we do know that it has some visceral analgesia properties, but I don't know how much evidence-based stuff we've got yet for that.
That's great. And then we had one follow-up question where they're wondering, if you have a rabbit that has discharge, do you immediately treat for Pasteurella?
Yeah, I'm sort of torn on that one, to be very frank, because the thing is that a lot of them, they just sort of have mild sneezing and then it goes away. And so you're like, do I risk inducing antibiotic resistance by treating a bacteria that I know is never going to go away and may not actually cause disease that's clinical enough to really be a concern, right? Because my rabbit Hazel, he had pasteurellosis and he would snort and sneeze for a little while, and then he would get over it and he'd be fine, right? So it sort of is a question of, do we treat them? And it's probably, I guess, comparable to like mycoplasma in cats, right? Where you're like, okay, there is a line where you kind of ignore it and you'd sort of do benign neglect. And then there's a line where like, no, I'm sorry, you're sick enough that I need to intervene, right? Oh, shoot, go away. Sorry, my iPad is, okay. So it's kind of one of those things that There is a line where you do intervene because you kind of have to, right? Because if they're getting to the point where they're having so much discharge that they're not eating and stuff like that, then you have to do something, right? But yeah, like you don't necessarily treat all of them. One thing it's interesting that I read, and it's kind of obvious when you think about it, but they're obligate nasal breathers. So one of the really important things if they have nasal discharge is to just clean it away, right? Because you can imagine, like, if you think about when your nose is stuffed, right, just clearing out stuff around your nose makes it easier to breathe. Well, imagine the only way you can breathe is through your nose. If I clear away that crap that's around your nostrils, makes it easier for you to breathe, right? So that's one of the really important things, but I don't necessarily treat all of them.
That's great. Thanks so much for coming and speaking with
Yeah,
us
absolutely.
today. I know that our members really appreciate your
For
time,
sure.
and it was really great.
Awesome. All right. Have a great day.
Yeah, you too.
Okay, bye.
Bye, guys.